Secretary, just allow me to share my screen. I presume that it is visible. Maybe you can confirm that for me.
Yes, Dr. Arif, it's visible.
All right, thank you. So, colleagues, all protocol observed. Good morning. My name is Dr. Stephen Kigera. I head the Quality Services Department here at MEDS. And I'll just be taking you through this presentation, focusing, of course, on the theme that is financing health products and technology supply chains, using MEDS as an example, or maybe taking you through MEDS experience. You'll agree with me that medicines are the center of healthcare, and they have to move from the source, that is from the manufacturers and the suppliers, all the way to the beneficiaries who are the patients. And for that to happen, you really need an effective supply chain. So you can actually argue that the success of any health program, of any quality of care, or rather, if your objective is to improve the cost and the effectiveness and efficiency of healthcare, then you cannot do that without looking at the supply chain. So as much as possible, supply chains must meet the tenets of effectiveness and also efficiency. And as we talk about supply chain, you cannot forget to talk about universal health coverage. And simply put, that means that all individuals, all Kenyans, basically are able to receive health services that they need without suffering financial hardship. And when you talk about universal health coverage, we're looking at health promotion, preventive treatment, rehabilitation, and palliative care. Basically, the full spectrum of health services. And the focus here is not just on cost, but making sure that the patient is able to access it, even at an affordable cost. So health financing, but also other components like health delivery systems, health workforce, the health facilities, quality assurance mechanisms, governance, and legislation basically play a very key role. And we're happy that the government of the day has been able to roll out this program now countrywide, and we're looking forward to a successful implementation. Of course, if you look at UHC, and not just from a country context, but where it is actually being implemented, there are definitely many challenges. Challenges to do with access, availability, and affordability because of stockouts, poor infrastructure, manufacturing setups that are not very robust, stockouts, and studies have shown that actually developing countries are mostly affected by out-of-stock situations where essential medicines cannot be made available to patients. From a human resource perspective, whether we're talking about availability of the human resource itself or the training component, we're still seeing challenges there, especially in low and middle income countries. Gaps within regulation. So, Pharmacy and Poisons Board is really trying, but they do have challenges, especially when it comes to funding. So they're not effectively able to deliver their mandate. So this is just a snippet of some of the challenges that affect universal health coverage. But then again, even as I say that, it's important that we have what we call a partnership between the government and the private sector. And one of the biggest players within the private sector when it comes to healthcare delivery is actually the faith-based sector. Studies have shown, whether it is here in Kenya or even in other developing countries within Africa, that between 30 and 40% of healthcare that is accessed by the general population, it is actually delivered through the faith-based mechanism. And just here in Kenya, historically, we have had the church invest quite a lot, in setting up programs for their faithful when it comes to health. of course, the different faiths. We have the Catholics, the Secretariat, that is a Kenya Conference of Catholic Bishops that have been around since the 1940s and have basically implemented programs geared towards delivery of health. The other side, we also have the Christian Health Association of Kenya. This is now mainly for the Protestants. It's a faith-based organization that has been in existence since the 1930s and have also been running, various health facilities and health programs from all over Kenya. But not to forget also the other faiths that the Muslims and the Hindus have also played their part. So it is always a saying that where you don't find a government health facility, most likely you will find a mission hospital there. So when these programs were set up, and you have the Catholics on the one hand with their many facilities, and the Protestants also on the other hand with their many facilities, they needed, a source of good quality medicines, and I think that's where now MEDS was born. It's one of the few areas that, putting doctrine aside, that the Catholics and the Protestants were able to come together. And in 1986, MEDS was actually formed. Our founder was actually Sister Joan Devane. And a feasibility study had been done and it was determined that there was quite a need and an opportunity to have medicines provided, especially to those who could not be able to afford them. So when you picture, I take you back to the 80s and, just picture this nun in an ambulance moving from one manufacturer to the other or from one supplier to the other, just collecting medicine so that they're able to pull it together and then supply it to the few mission hospitals. That's how actually it all started. But then when MEDS came into the picture, a different setup was, a different supply chain model was set up. Some of the challenges that, just led to the push for MEDS to be set up was also the fact that the central medical stores back then was not able to meet the needs of both government facilities and also the faith-based. And again, also the issues of stockouts were there. And so when MEDS was set up, it was set up as a revolving drug fund. So many donors were gathered and they put together a fund to support the purchase of medicines. And what MEDS would do is that it would, take up the role of placing orders from suppliers and supplying directly to the Christian health facilities. And then the bills would be sent to MEDS for payment. It was not until 1989 that we set up our first premises in industrial area there. And we were able to maintain some buffer stocks. So we didn't have to move, the founders didn't have to move from one supplier to another to gather medicines for supply. In 2010, we now moved into our current premises, which is now able to house our many operations. Basically, the strategy for MEDS is to procure and distribute mainly generic pharmaceutical products, but those that are of good quality, and of course at an affordable price, because our mission and our vision is basically to serve the needy. So we draw a corporate identity, of course, from the faith-based realm, and we describe ourselves as a Christian not-for-profit organization, which is registered as a trust for both the KCCB, the Catholics, and also the Christian Health Association of Kenya for the Protestants. We have mainly 3 mandates. Our main one is supply chain and distribution of health, essential medicines and medical supplies. But we do also offer quality assurance services. We have a WHO pre-qualified lab that basically does analysis for various segments of customers. We also do have health advisory services that basically helps to position MEDS when it comes to policy formulation, but at the same time offers a unique service of training healthcare workers, especially within the faith-based fraternity, in various topics with regards to delivery of healthcare. And that program has been running for more than 25 years now. When we talk about resilient supply chains, I've just tried to summarize it here, what makes a supply chain successful. And I'll just borrow that from, again, also our perspective here at MEDS. I guess it all begins with transformational leadership, because if you don't have a visionary leadership, then definitely the business will not survive. So We are fortunate to have had that. I believe as meds, we're also flexible and we're able to withstand significant disruptions. Of course, the example that comes to mind is when we had the COVID-19 pandemic, and we still remained open, and we're able to continue supplying medicines to our clientele. A good corporate culture, we try to foster innovation, but at the same time, we make sure that every employee here is aware of the strategic goals, so that we all move in the same direction. We have a very robust digital strategy, and I'll be talking about that in the next coming slides, because without technology, really, then you cannot talk about efficiency within your operations. A good quality management system. We are ISO certified, but we've also adopted international standards, leveraged on WHO good distribution practices. And of course, we've made our lab WHO pre-qualified so that our results can be trusted. And then experiential learning. Through the many years of being in operation, then we normally put those learnings into good use. And of course, we get a lot of customer feedback that helps us to improve. So we basically serve, So we basically serve a quite a big pool of clientele. Over 2,500 health facilities actually draw their products from meds. And what we've tried to do is to zone the country in such a way that we're able to effectively manage logistical services. If you look at the terrain of the country, not all of it you can say is basically at par. There are areas which are difficult to access, but we try as much as possible to do what you call door-to-door delivery. And we actually do that at no cost. So that is just in keeping with our mission of making the products affordable to our clientele. If you look at how we manage our warehouse, again, looking at issues of cost, we can describe it as a agile supply chain. We employ what you call lean strategies. At the same time, we also try to be agile and responsive. When you talk about lean orientation, we look at cost here. So we try to make our operations as cost effective as possible. How do we do that? We employ the use of technology, barcoding, for example. We select our products carefully, consignment stocking. We qualify our suppliers because we do not want reverse logistics in terms of recalls, returns, and ISO has helped us also to effectively manage our processes. But at the same time, we also want to be a responsive supply chain. So what we try to do is to maintain service levels of more than 95%. That is the fill rate for every order. But we also send out field staff to be able to interact with the customers and our clients, and try to support them in whatever challenges that they have. Like I said, also we do door-to-door delivery at no additional cost, and that is something that our customers are happy about. If I just briefly talk about our QMS, our quality management system, so a few basic tenets. We select our products. We first start with product selection. So we have our own internal formulary. We don't just draw membership from our internal staff. We get experts also from academia and also from practice, and they help us to decide what products to keep within, or rather to stock within our product list. And that list will keep changing annually as they meet, but we're heavily informed by the WHO model formulary and the Kenya Essential Medicines list. Of course, we do inspect all our inbound consignments. We regularly test products from our suppliers, and we also have a pharmacovigilance system that looks at adverse drug reactions from customer feedback, and also work together with the pharmacy in poison spot in resolving those. If I talk about pre-qualification, so two aspects there. We do pre-qualify our suppliers, and that's important. We just want to make sure that whoever we deal with is a supplier who is able to meet our needs. Like I say, we are a national supply chain, and we must make sure that, first of all, the standards are met, and they have been certified by the regulator, that is Pharmacy and Poisons Board. But we also we look at the quality management systems. Are they able to manufacture drugs in the way that they're supposed to? Are they financially stable? Do they comply with legal and ethical requirements? They have favorable trading terms. And it's only that list of pre-qualified suppliers that we normally rely on when it comes to procurement. And we do this exercise continuously, and every 5 years we qualify suppliers. But also from a product perspective, we have tried to develop specifications for both the medicines and also for our non-farms, medical devices and the rest. And it's based on those specifications that we assess products. And so we also do have a pre-qualified list of products. We do test from our own warehouse, and regularly every month we will sample at random. Of course, we have a plan that is risk-based, and we just check the quality of medicines that are coming in. And we've found quite a bit of success in that because over the years, we found that fewer medicines actually fail quality tests. And I think that's just a testimony of having a very good quality management system. That means then you're able to guarantee the quality of medicines that you're supplying to our clients. The journey has been long since 1986 when we were founded, and we've had various steps and milestones in between. And right now, I can say the latest milestone is the fact that we were able to successfully decentralize. We started off, we set up our first branch at Kisumu, and from there we were able to serve the western part of the country. So I'll not dwell so much on this, but we're very hopeful that as we continue to exist, then we will be able to record various successes. Like I mentioned, we procure basically through a restricted tender and a direct procurement, and that is the pool of suppliers is basically the ones who are pre-qualified. And we internally here, we also do have our own technical evaluation committee. If you look at the various laws like the PPDA, it does mention an evaluation committee that would look at products and assess them. So we do have our own internally here. But most importantly, every year we have what you call an annual conference with our suppliers. And we use that forum to communicate any feedback as the year went on in the previous procurement period, any issues with quality, performance, and they all get a scorecard. And it is in this forum that we're able to discuss challenges and see how to improve maybe in the next procurement period. And I think even as we talk about financing, suppliers are very, very important partners. And I think it's through such forums that also we're able to understand and work out challenges that will not necessarily negatively affect the supply chain. Our stock list has been growing over time since 1986, and we are now at 2,110. Various categories, basically touching on equipment and instruments. We now are able to supply equipment, essential medicines, pharmaceuticals, non-pharmaceuticals, and also what we call a supplementary item list. So our inventory value is currently at over $7.7 million. And we actually, for stock items, we actually keep what you call 4-month stock cover. It's very, very important to have what you call working stock, but also safety stock, so that you're able to be responsive to customers. When there's a need, you don't have to go back and keep procuring again. We have enough inventory to be able to cater for all our clients. But for those that you're not able to stock maybe full quantities, then we still go back to a pre-qualified list and source when the need requires. There's a classification that we follow, ABC, at the same time the VEN model. And every year we do what you call an annual stock take, but every month we do what you call a cycle count. And that's important so that you're able to avoid expiries, and you're able to value your stock, and you're able to analyze and see which stocks are not moving, and then implement corrective measures for that. We do have our quality policy. So in our quality policy clearly documents our commitment as a supply chain organization, in just meeting the needs of interested parties and customers. And we also commit, to engage in quality assurance services activities so that the products we supply to them meet those requirements. But then we are also very open to partnerships, and in every supply chain, there has to be that working together, that teamwork between various partners. And as a way of improving, we engage with partners from various divides, not just locally here, even internationally, so that we are able to meet our objectives. And that we've documented in our quality policy. Allow me then to conclude with this slide here. Good business practices are important when it comes to running supply chains. And when we talk about financing, you cannot miss this one out. For supply chain costs, they can actually make or break any supply chain. So it's very important that all costs are incorporated when it comes to running the supply chain. So when we talk about procurement costs, stock holding costs, you really have to balance that. So you can keep buffer stock or safety stock. That will probably increase your stock holding costs, but then it reduces your procurement costs. And when we do that analysis, then we know for which products we can keep fewer quantities and then order more, or for those quantities where we want to keep more but order less, place less orders. And then we also measure our distribution costs so that we always make the business sustainable. Good accounting practices are important. So our finance team here has implemented what we call the IFRSs, the International Financial Reporting Standards. So whether direct and indirect costs, tangible costs, and intangible costs like depreciation, all have been put together so that we are able to measure whether we are doing well or not. Operational excellence, this is a journey that we had started a while back, being now a supply chain that operates a pool system of distribution. It is important that we keep improving, and we have KPIs. We have to measure various objectives, like for example, service levels. Are we meeting the 95% fill rates that we've communicated to our customers? Is our turnaround time for orders within our objectives? Delivery times, delivery lead times, and also product quality. Those are some of the KPIs we keep measuring so that we also keep challenging ourselves to improve. Risk management, we have a functioning internal audit function that looks at basically the enterprise risk, and we try to put in controls to mitigate those risks. And of course, we do maintain our drug revolving fund. So this is actually a sum of money that is used to procure an initial stock of essential medicines, and you keep replacing that stock using the same fund. So as we operate this drug revolving fund, our objective is not to maximize profit or not to make profit. We are not for profit, but to maximize access. So every year we will keep replenishing that fund so that we are able to continue running the supply chain. All right, thank you very much. Maybe I'll be taking questions maybe at the end of the session. Over to you, MC.